celebrating yourself?
I'm well. I'm sleepy as all get out, but I'm well.
I'm glad to be in the service
Hey,
one more
glad to be
time.
in the service one more time. Oh, you just said a whole word in 2.2 seconds. I love it. Oh, all right, all right. Well, good morning, everyone. Everyone, welcome to the Saturday Morning Tea, where we discuss information, news, education, certification tips, entrepreneurship, just all things the revenue cycle at large. Yeah. that we lo- that you gotta love it, even if you might hate it. You still gotta love it. It's a love and hate relationship. So as you come in, don't forget to hit the thumbs up or like button. I am Clarice Warner. I am the girl with the pearls. I am the founder and senior education director of the Professional Reimbursement Education is key. And PRN is a healthcare compliance consultancy located in Cincinnati, Ohio, that specializes in revenue cycle and regulatory compliance in education. Now, I hate to do it, but I got to ask. Let me ask you, do you know what it takes to be a certified, marketable medical coder? Well, before I introduce my co host, who gave us the word already at the beginning of the show, let me share with you information on a free, yes, free, totally free 99 email course on the 5 steps to become a certified marketable medical coder. Are you interested in medical coding, but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified, marketable medical coder. Learn more at bit.ly/5stepscoder. See, all it takes is a little beat. I'll come right back. Okay. If you are interested in you're interested in getting more information about the 5 steps to become a certified marketable medical coder, then check out the video description for the link. Joining me today is my illustrious co-host, Mr. Jesse, the registered trademark. Put some respect on his name, the coding nurse. Sir, introduce yourself and tell the folks all about you.
Good morning, everybody. My name is Jesse. I live in Philadelphia. I have been in healthcare for a very long time, and I transitioned away from the bedside into HIM in 2014. During the pandemic in 2020, I created a company called The Coding Nurse, where I help nurses and other people in healthcare with a clinical background transition into the wonderful world of HIM.
What a wonderful world. And how's that going for you?
It is going great, and on
Yes.
Monday, I start my first contract in coding education.
Yay! So those of you who are in the Patreon, you know all about what's been happening behind the scenes. We talk entrepreneurship and we've even dibbled and dabbled in government contracting from our perspective. And so, congratulations. So
Thank
excited for
you.
you. So excited for you. All right, all right. Let's see who we got in the house. Who we got? Good morning, Tanika. Oh, wait, there was somebody way early, but even before the show started. Good morning, Alanda. Good morning, Renita. Good morning, Miss Vicky. Hey, our on the street correspondent, the crafty coder is in the house. Happy Tea Day. Yes, yes, yes. So congratulations. Congratulations.
Thank you.
She said, hey. What did she say? Wait a minute. About to make you proud. All right, all right. Love it, love it, love it. Okay. So, before we jump in, let me remind you that you can join in, and we encourage you to join in and be part of the conversation. This is, in fact, a conversation where we bring the topics, but we love to hear your feedback and your comments. And if you agree, fabulous. If you don't, wonderful. we're not opposed to anyone who sometimes we don't even agree with each other. So we're not opposed to folks not agreeing with our stance, but we do feel that these topics and these things that we bring to you every week are important and things that we need to think about, consider, and have a conversation about, particularly with a little cup of tea. All right. So so don't be shy. You can join in on the conversation, and your opinion matters and is welcomed here. So use the chat. If you have a question, please type Q first so that we know it is a question and we don't miss it. And so if you understand that, put your teacups in the chat. Put your teacups in the chat. How about that? All right. So for those who are just joining us or watching the replay, today we are talking exposed.
Mhm.
I can't let it go. I don't know. I can't let it go. Every I feel like every week something else is coming about this whole thing, and it's we're gonna talk about it. Exposed. Change healthcare, hackers exploited known risks. hmm But first, we have our church announcements. And I see the teacup. There you go. The teacups are in the house. All right. Love it, love it. All right. Um, I didn't get to play with my music. Play with the music since I talked about it. Even though I guess that could be part of the church announcement. So my daughter created a whole song for me. Yeah,
Okay.
for those who know me, I always say my favorite quote is "Don't wish for it, work for it." I say it all the time. And she created a little jingle for "Don't wish for it, work for it."
Okay.
That happy. Well, there's a video component to it that I haven't watched yet, but I've heard the song, and so I've been bouncing like, yeah. See, I have a whole bunch of creatives over here in this house. Uh-oh, and we got the usher fingers. Usher fingers to the left. Usher fingers to the left. Please have a seat. Make yourself welcome. Welcome. All right. So really my church announcements for today are perfect. I don't really have much. But I did run into an article. Okay, I ran into an article and it was a part 3, and I was like, well, what happened to part 1 and 2? I never even saw them, so I gotta go back and check them out. But they were talking about auditing and how AI is coming for, in a sense, for auditors. But we know that AI has been a part of auditing for years, particularly at, yes,
Can you turn down the music a little bit more?
I'm sorry. Am I too low?
Okay, that's yeah.
That's better. Okay,
Yes.
so AI has been coming for, the article was talking about AI coming for auditors. And if you know anything about government auditing, you know that they've been using data analytics and all types of tools to assist them in their efforts in uncovering and investigating all the things that they say that they're looking for. Well, in this particular article by Edward Roach, he says that there's some double standards in the algorithms, though. So, and I'm just bringing this to everybody's attention because even in the article it says we a long way long way from AI remotely being able to do the work of medical auditors, because it's so much that's involved and it's so detailed. But what they can and do use it against or for is kind of that initial cursory fact finding So the thing is, you have hospital systems or people submitting claims, and then you have those who are auditing them, and they're using quote unquote the same technology um, for technically the same thing, but just in different perspectives and point of views. So he's really just was speaking about um, one kind of thing to be mindful of. So, when CMS learned and heard about, how these providers have significantly increased the amount. Well, actually, they heard about it, but research has already showed, so they had some data to back it up. But how the amount of reimbursements that healthcare providers are able to obtain has increased, largely or somewhat in part to AI, pushing out and doing some of that initial claim submission, da 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 da. We've talked about that over and over again. So CMS was like, okay, well, check, but I got you too. So they began their and modified their recovery audit program to have it use that same information to identify templates or copy and paste data or clone records. So they're kind of using that to say, okay, yeah, you are allowing AI to push this stuff out, but we all know that it's not humanly possible for someone to actually monitor all of this stuff or put some eyeballs on this stuff before it goes out. So we gonna match you, and we gonna check for copy and paste and clone records and all of those things, which they clearly discuss, that says we shouldn't see. You shouldn't have. But the problem with that, or one of the things, and as a result of that, they have recovered more than $1 billion in Medicare reimbursement with their match game. The problem is the problem that they see in this particular article or from this particular author. I won't even say that it's a problem, but it's difficult to know whether the claims themselves were faulty, or whether the demand for reimbursement was simply based on the fact that some data was replicated or cloned, even though the data itself was accurate for the patient. And then, of course, another problem is that even cloned data can be perfectly accurate, particularly if the patient has more or less identical problems to another patient. So they're saying that there is a double standard emerging with the use of artificial intelligence. And the lesson is that if the technology is used for the benefit of the provider in a way that may increase the amount of reimbursement they are able to obtain, then it is assumed to be invalid. And on the other hand, if the machine learning and AI is used to audit or crack down on the healthcare provider and take away their revenue, then it is presumed to be valid. So in general, there's no way to correct such an implicit bias in the overall auditing framework, which is another reason why the auditors are not going anywhere. Human auditors are not going anywhere anytime soon. So I just wanted to bring this information here. However, and put this on your radar, because of course this will be something to continue to watch in the future as these AI systems continue to develop. Mr. Jesse, did you have anything on this?
It's just, well, I want to give a shout out to the Crafty Coder, because she had sent out a link to the Congressional Hearing with the CEO of Change Healthcare. And when I tell you, you have some senators who were like soft shoeing, but the chair of the committee played no games. He told the man that he had failed America. I mean, he did. But I'm telling you, I'm not surprised because when I first heard it, I I, I said it here. I'm like, I worked for them, briefly. They their security was always trash. When you having people use their own personal equipment, it's so easy to. That's why companies provide equipment so they can lock down who has access and how people get access. You have somebody using their personal computer. If your personal computer has a virus, they can get into your system once they log in, or they can use their information from a previous session to log in. It was destined to happen.
Okay, so since you already done segued into our
Oh,
our
I'm sorry.
topic, let us just move on over there. So, but again, you heard it first here, where we talked about something's not right. Mr. Jesse called it. Something is not right. Something is real quiet. Folks ain't saying it, it hushes the word. And one thing that we always know to be true is to follow the money. Where the money reside, where the money reside. So let me just give us a little additional perspective on what we're talking about today. So back in December of 2022, Christopher Bing wrote an article that said U.S. agency warns that hackers are going after Citrix networking gear. Now I said 2022. 2022. And this was just an article in December. So this was going on prior to December of 2022. Knowledge was gained way before this article was written. It says a hacking group named Apt5, which is suspected to be Chinese, has exploited a vulnerability in networking gear from U.S. technology company Citrix Systems to spy on targets. The U.S. National Security Agency advisory on Tuesday reported the activity and requested that victims who discover additional evidence of an attack reach out to the NSA, that's the National Security Agency, Cybersecurity Collaboration Center, um, which was opened in 2021 with the mission of public-private sector collaboration. Citrix, in a blog post, said it was, quote, aware of a small number of targeted attacks in the wild using this vulnerability, end quote. They was aware.
Mm-mm.
They was aware. I do have a I, I, I do have my whistleblower attorney information that I still need to share with y'all, but they was aware. I, the NSA alert did not say that App 5 is Chinese, but private sector security researchers have reported this suspected link previously. App 5 is known for breaking into telecommunications providers as well as government organizations, satellite, and other technology companies. Historically, the hackers have conducted operations across Southeast Asia and Europe in addition to the United States. The China's embassy in Washington did not immediately respond for a request for comment. Of course they wouldn't. So again, keyword, they knew this was written back in 2022. This week, oh, I'm about to butcher this name, but Seba Siddiqui said United Health hackers use stolen login credentials to break in, the CEO says. Um, oh, okay. So it says hackers breached by using stolen login credentials that gave them remote access to its network. The largest U.S. health insurer will testify before a House panel this week. Were they the ones that was at the Senate hearings?
Oh, it was the House. I thought it was the Senate, but it was the House. Okay, that's where it was. It went down.
Uh, I said, okay. So, Citrix wanted to come in and basically correct. So there was a correction on the story. Oh, it's already been corrected. So the one I'm reading from is the April 30th. What I guess there was one that came out April 29th. Um, which I guess the title was different because it probably hit Citrix all in the pocket from the original title from the correction that they said. So it said that, yeah, United Health CEO Andrew Whitty's testimony before the House Energy and Commerce Committee will follow weeks of disruption to American healthcare since the insurer's Change Healthcare unit was hacked. Um, on the morning of February 21st, we all know what happened. The cyber criminal gang Alf V, aka Black Cat, locked up Change Healthcare systems and demanded a ransom to unlock them. Whitty will tell the House panel according to a copy of his written testimony posted on the panel's website on Monday. Not knowing the entry point of the attack at the time, we immediately severed connectivity with Change's data centers to eliminate the potential for further infection. The criminals used compromised login credentials to remotely access a Change Healthcare Citrix portal that did not have multi-factor authentication, according to the testimony. This portal, offered by the private tech company Citrix Systems, allows for remote access to an organization's desktops. Multi-factor authentication is a widely prescribed layer of security that prevents hackers from using stolen passwords to break into systems. It is unclear why the Change Healthcare portal did not have this security measure, and a United Health spokesperson did not respond to questions about it. Of course, she didn't. A Citrix spokesman didn't immediately respond to a request for comment. U.S. officials issued multiple warnings about security loopholes in Citrix tools late last year, some of which were being used to breach healthcare groups. The hearing before the panel subcommittee on oversight and investigation will focus on the cyber attack's impact on patients and providers. Last week, Whitty said the company had paid the hackers a ransom to ensure the decryption of Change Healthcare systems, although the size of the payment is not known. The company has been scrambling to contain the hit to healthcare payment processing across the country. Change processes 50% of all medical claims in the United States. Wow. That's large. That's huge. As of April 26, United Health Group had provided more than $6.5 billion in accelerated payments and no interest, no fee loans to thousands of healthcare providers, according to Whitty's testimony. But your friends over here knew that something was going on. Did your friends tell you? Did you? Well, you should have known too. You had to do your own due diligence, even with your friends. I mean, we cool with everything, but we got to make sure everything is everything, right? Right. Okay. Mr. Jesse.
I would be willing to bet money that their because they mentioned the data center. I would bet money that all of their tech hub is offshore. I'd be willing to bet money,
Uh-oh.
and that's
Uh-oh.
probably also part of the problem.
Uh-oh. Good morning, Carolyn. Uh-oh. You heard it here first. Good morning, Tanya. Yes, the house said it. All right. That's more to look for. Because imagine that. You go offshore and still not have all the protections, patches, corrections. I mean, hell, somebody might send me an email, and before I could even open the email, I got to go through a whole multi-factor authentication
And
thing.
I mean, just on a personal level, you need it because I know, like I one of my friends was attempted to be hacked on Instagram, and then some kind of way, they tried. I had to go. So I kept getting these notifications that somebody was trying to reset my password. That's the benefit of two-factor authentication,
Yes.
and that's just a personal Instagram account. So you have millions of people's private health information, and you
And
can't.
and personal financial information. I mean, because
Right.
you got all the things to you got all the things. All the things. She said she betting with Jesse. What is that? What? See, I watch sports, but I'm not a gambler. Whatever the betting thing. Look, we need to set up that whole thing right now. Oh my god. Oh my god.
It
So
just
back
gets
to
worse.
your original or original point about, you know, not having this login. Somebody stealing somebody's login because they could easily access it because they didn't have the information or whatever the technology in place to protect it. Do you know how many everybody probably been scheming this? They know everybody working from home. We in the middle of a pandemic. Everybody at home. Everybody still got to work. Everything still got to process. All of this was the perfect storm waiting to just pounce on.
But it this squarely, I mean, there's change has they have no excuse. Absolutely no excuse. Because before, I know I always talk about Inovalon, but I'm telling you, as a company back before they went public, they had their stuff together. They were the first people that I ever heard of to do two-factor authentication. Matter of fact, it wasn't even a thing
Across the
on a
board with
computer.
anybody. Yeah.
They sent us these little fob things that
Mm-hmm.
that would
A
generate
code.
a code.
Yep.
Yes.
Yep. I remember.
I mean, come
And if
on.
you only that code only lasted for like 15 seconds,
Yep.
you better hurry up and put that code in, or boom, you got another one, or you gonna have to keep playing this game in order to get into that system. Yep.
And then after that, then you had to log in through a VPN. Like they just had layer on top of layer of stuff. And it's all to protect information. It's not about us. It's about the
Mm-mm.
information that we access to make sure that
Exactly.
that's safe.
Exactly. Exactly. Because as this example clearly points out, you never know who's tried to or has stolen somebody's information to get in and do harm with the information that we have access to.
I also think, on a personal level, I think that between the lawsuits and the fines, I really think change should be forced out of business, but it's not going to happen. But they
Well, I don't
should.
even know had the lawsuits, the personal lawsuits, the class action lawsuits. Have they even begun?
Probably not, but
Probably not.
I mean, this is egregious. Like they should not be allowed to operate because that's cybersecurity, not even 101. That's remedial cybersecurity.
And 50% of the claims in this country, do you know how much money passes through in claims every single day?
And you just out there just whatever.
Wilding out.
And people are telling you and you're not doing nothing about it.
And
That's
nothing.
the thing.
That's what makes you culpable. That right there.
And you would have thought, even because the company I work for, they got hacked the day after Thanksgiving last year. You would have thought that change would have done an assessment then. Well, what about us? Are we going to be vulnerable, knowing how much how big of a player they are in the game? They just sat back. I'm telling you, I wouldn't be surprised if it's also part of an inside job. I'm telling you, it's just no.
So to your point, Miss Carolyn says she think it's those billing encoders they're hiring in other countries. Oh,
Look,
offshore.
Carolyn, you could be right because look, it's probably somebody's cousin Listen, at my job, they don't even have two-factor authentication. No, they got on the horn. And why they always want to blame the daggone Chinese for everything?
Everything,
Because,
everything.
and I tell you, because
I
when
remember
we
when it first came out and they said something like that, and then they had to try to walk that back. I was like, for real though.
because when we got hacked, I had time on my hands. So,
Since you've been away for yes.
so, um, I watched this documentary. It's on YouTube, and it was about in Canada and in smaller places in the United States that they were hacked. And this was like maybe 2021, 2022. And those people were from Eastern Europe. Now you don't blame the Chinese, allegedly.
Allegedly.
And
Well,
I'm
I
like,
think in Russia, I think there was a Russian finger pointing to. I'd be like, first of all, know who Ray Ray is before you point Ray Ray out. Like, don't there's a lot of Ray Rays out here, and everybody then they'll be rallying up all the Ray Rays. No, make sure you know what you're dealing with before you just point them out. Point them out. Tanika
and this
said, I think I said that I think it's a part of an inside job as well. Yeah,
Mhm.
yeah.
And this is also a reason why the government is trying to get rid of Bitcoin because that's how the hackers get paid because you can't trace it.
Exactly. And then you got the first group that then took the money and like deuces. Now you got a second group. Did they pay the second group? Have they said anything about paying the second group?
And can I tell you, I'm not mad at
Because
them
the
people.
third group probably coming too. Like y'all gonna be paying this into forever. Keep
Exactly.
playing.
It's gonna be spin-off on top of spin-off. Well,
Oh,
listen,
spinoffs. And the government has already told you. They done warned you. They done said. But y'all, well, case in point, the government told you about this issue with these uh not having the multifactorial authentication. Y'all ignored it. The government told y'all, don't pay that ransom. Let us do our investigate. Y'all ignored it. Y'all paid them. Here we are again. Y'all still ignoring. This child needs a good a good a good discipline. This child is wayward. This child is out here in these streets. Do you hear me? Hey, good morning. Good morning. Welcome. Welcome.
good morning.
This child is out here in these streets. Just they don't care. It's what is it? What did they say? Don't ask for permission. Ask for forgiveness. They just out here just doing what they need to do. Well, hopefully that forgiveness that they're gonna be asking got a whole bunch of dollar signs behind it because they're about to be paying out the wazoo, the wazoo, right?
Exactly. And I
They're
can
about to
I
be
mean,
paying.
and whatever they pay is not enough. I'm
No,
telling you, they should be forced out of business. And who knows? And what they might do, because what everybody does is they rebrand and change the name.
you know what? So, so I went to my office the other day, and it's a few home health agencies in there. They've been there. I've had my office for years, and they've been there for years. And I swear, this one office must just be the home health office. I don't know what it looks like on the inside, but every so often the name changes. It's like, well, wait a minute, that's not the same name that it used to be. Every so often, I'm like, well, they flipping and dipping all day
Mm,
long. Crafty Coder says, I think there is one class action already started or started already. And of course it won't be the last. Of course it won't. Of
nope.
course it won't. So can you imagine the cybersecurity they have in those other countries for those coders and billers? Probably zero. Or a baby or a baby can crack in. Also, HIPAA has no power outside of this country. Absolutely correct.
Facts.
And folks know this. However, this is the thing, and I'm interested to know how is this being enforced because it doesn't seem like it doesn't seem like it's being enforced. So I learned when I was at the HCCA conference that while the government is a little lax with um I mean, they have the HIPAA protections, but they're a little lax with what can be shared off with offshoring. There's state laws, and a lot of these states, I think there were 14 states, they stuff is ironclad. However, I don't know what the enforcement looks like. I mean, basically, you can't send a piece of gum across the shore without having some problems in some of these states. They're very, very, very restrictive. But again, do they have time to enforce this? Do they have time to monitor this or whatever? But they are clear in their and maybe it's a setup, like if something pops off, then boom, states now get involved or whatever. But I think there should be something going on where they're at least monitoring this or have a better handle on this. So if your business is in those restrictive states, then technically, if you're doing these offshoring, you're breaking the law. How about that? So there are some additional. I mean, everything you start out with the federal level, but then your states would be like, I don't care what they say up there. This is what we gonna do. But again, if there is no enforcement, or maybe there is some enforcement, and they maybe they're smaller, but some of these larger companies, I don't know. And do they realize and understand that from the state perspective? Because I was shocked. I was shocked to even know that in my state they are very restrictive. Hence, yo people over there. Uh-huh.
But I wonder if states are going to come after them, because some of these states, like they're pro business, but now they'll restrict your access to healthcare, but they won't they won't come after them for not protecting your healthcare information.
Right. She said they're probably in the process of rebranding as we speak. They established a company in Delaware with a U.S. address. I don't remember if Delaware was one of my 15. I had to pull out my notes. Um, yeah, but he had a whole. I had to pull out my notes because he had a whole slide that had all of the companies, or I'm sorry, all of the states, and it listed, what the restrictions were. I'm going to get that. I have to show that. I think you can do this in other states now. So yeah, that's crazy. Crazy. And if that's the case, again, when is that part of it of the coin going to drop? Like, this was offshore.
Exactly.
I know. I just imagine, especially if it's well, it has to be. There's not if it has to be any revenue cycle personnel, any revenue cycle positions. I know those American for uh, healthcare workers groups are going to be on fire. I could just only imagine. They on fire already, but I could just only imagine if that is the case.
And whenever we have this conversation, I still ask the same question. How is it that these companies can offshore the same type of work that we do, but then when you apply for a remote position, not only do you have to be a US citizen, but you have to live in the continental United States? Why is that? Why shouldn't I? If you have these people over here in you
Where's my
know
tea?
in other places, I'll say that as nicely as I can on a Saturday. You
Say
have
it how
people
you
in
say
other
it, sir.
places.
Say it how you say it.
Why can't I be on a beach in
Grab your
Mexico with a
teacups.
laptop? Why? Because these people, they in a corner of their daggone parents' tea shop, accessing our health information, but I got to be here. Why?
Wow. Mhm.
I'm just asking.
Right. And think about some of these organizations, you got to have background checks and all of the things. They like, what, you only want $5 an hour? You're hired.
Yeah.
and I don't have to provide you with all the extra stuff, you're hired.
Well, they always say, well, honestly, I can't see any, I mean, because other than healthcare, see, now I'm thinking, well, other than change, because if they do 50%, then who does the rest?
Right.
And
And where are they?
exactly,
And what they got
see,
going on?
there we go. That's what I'm getting to.
Mm,
Yep.
follow the money. Follow the money. Look, I know. Exactly. And maybe did they listen to the government's warning? Were they and maybe it's 50% spread amongst others. So maybe it's not just one other
But I,
organization.
but at this point, we need to be knowing who they are because
True.
look, because we need to be looking at them like, I'm telling you, like Kelly Bundy said, there's something rotten in Denver.
Uh-oh. Wow. And at the end of the day, the harm that has happened to these patients, I mean, everybody up in arms, like the industry is up in arms because of the loss of the financial losses to these organizations. Later for that, I mean, it's big, and the providers, they not getting paid. It's big, but the patient is just exposed, ass out, just exposed for
Mm,
more stuff. And the patients don't have the means, the wherewithal to protect themselves against a hacker.
they don't even know they should. Most of them.
Oh, until you get them letters in the mail talking about, unfortunately, you were involved in a breach, da 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 da. Let us offer you a year's worth of
A free credit
free
monitor,
credit by
as if that. Okay, that's all I need. Okay, I feel so much better that you can get for free anyway.
prior to. Oh God.
Because what they should be doing is, and I don't. This is, well, it's a little segue, but it all applies.
Go ahead.
They need to be telling these seniors because we all know that there's a certain age population that accesses healthcare a lot more. They need
Mm-hmm.
to be telling the older population that they need to have their credit profiles frozen. Now, I'm sure for them, they don't even know what that means, but
Correct.
they need
But
to.
yeah,
Somebody needs to explain it to them and let them know why. And this is why.
absolutely, absolutely, and give them that example. What Vicky says, like you guys says, is double standard and using their security measures as it benefits them. Yeah, this is horrible, horrible.
Well, this is going to be going on for the rest of the year because little by little things are coming out.
And that's
So
the thing too. That
right,
look, Netflix already write. I'm sure the writers already writing like,
and we can't leave out my people frontline because I tell you, frontline will give you a documentary.
Uh, and you'll be glued. Like,
I'm
really?
telling you, they really do really good ones. And
They do.
whoever and they did it. I saw like they did an interview with the guy who narrates them. His voice is perfect. I
You don't
mean,
want to move. You be frozen. Like,
no, because he really talks like he is really spilling tea. And this person met with so and so on such and such a date. I'm like, what?
say yes, he has a great voice. Be like, really? Well, what did they
Yes.
talk about? You get closer and closer. Like, well, what? What?
Look, you be I sometimes I'm going to ask him, Junebug too?
Oh my God. Not June bug too. I cannot. Oh goodness. I don't know. Y'all just, some additional things to think about as we navigate these these healthcare streets, and we're already in a pickle as it relates to everything healthcare. Everything is changing. Everything is changing. But now put
Everything.
this additional layer, because again, this was loan money. Look, they gonna go after them like the PPE people.
Yes, yes.
See, that's a whole other conversation. But it's a mess.
Oh, because that was another thing that came up in
Look,
that
you sounding
hearing.
like the frontline man. We're like, here we
See,
go. Let me
yeah,
let me grab my teacup. It ain't close enough.
and that's another thing that came up in in that committee meeting. There
We need to
was
get that.
one.
I need that. I'm gonna have to
Yeah,
get snippets. Like, can we get snippets of that? Can we do that? We'll figure out how to do that.
the
Um,
chairman raised the issue that he was afraid that because Change thought they were doing something when they were giving these providers these loans. First of all, it shouldn't be a loan; it should be a grant because it's your fault. But
true, true.
but the chairman was saying that he was concerned that they would use this information because who's vulnerable and who is going to be the most impacted. These providers who are probably just barely holding on. He was saying that he was afraid that they were going to use that financial information to gobble up more practices. And I'm like, I never even thought about that.
Wow. And I just saw an article, and like I said, well, I was gonna put a video about this, but about the private equity firms and so that's even bigger. Wait, because now they
Yep.
have inside information about who's
Yes.
vulnerable for them to pick off.
Yes. And he said
Oh
that
my
was his concern, and I'm
God.
like, wow. That
Oh
when he's
my
that's why I'm telling
God.
you, like that hearing was lit.
Oh my God. The whole light bulb. So this bigger than hell, they may be complicit in all of this. They ignored this stuff for a reason.
Hmm.
Oh wow. Wow.
So it's deep,
That's real deep, because now you got all these people's information to
all of
know
it.
that
And
they struggling, they this be
yep,
like, boom, here's one, go get them. That little corner boy over there struggling, go on, take that corner.
well, let us forgive your loan and then give you another, $300,000 of going about your business,
Mm.
and don't hold us liable.
Mm. Wow.
So they
Well, I
did
told
call
you
the
the
court.
government has added, OIG has added these private equity firms as part of their upcoming investigation. So this gonna be real, real. This gonna get. Well, I'll be glued to healthcare news on cybersecurity and private equity firms and whatever. But know that all of this has an impact on all of us, because it
Everybody.
changes. There's a potential to change access. There's a potential to change the quality of care that you get, because oh, depending on who these private equity firms are, what their values are, because it may be profit over patient. Wow.
And through it all, we still have providers with bad documentation. Nobody's
Right.
focusing on
Nobody's
that.
nobody's telling them how to do it right. You know what I'm saying?
No, because look, that they concerned with, can I still stay in business?
That's all they concerned with.
Look, they not trying to
Wow.
hear. Look, they not trying to hear nothing you got to say about no acute versus chronic. Nothing.
Even though it could make a difference in their
Right.
bottom line. All that documentation could definitely make a difference. Wow. Ooh, yeah. Mm-mm-mm. This is very interesting. See how we even come with a topic and it did a whole spin.
Hmm.
Oh, I feel like I just need to. dig. You know how I like to dig. You know how I like to do my research, right? I don't have the time today. I need to make some. Yeah, she said, it's provider over patients right now. Yeah. But imagine how worse it could potentially be if it's all about the private equity firms and their mission statements or vision statements or their core values as it relates to their bottom line.
Because
This the
now,
the healthcare, the organization or whatever, that's just a kink on the chain. That's not their primary business. They don't care about that.
because before you just think about, profit over patient, it's going to be even more so for some of these practices now, because not only were they probably struggling or, just showing a little bit of profit, now they have to pay somebody else some money back plus run a business.
Mm-hmm. Mm-hmm. Yep.
That's why I don't believe it should have been a loan. I think it should have been a grant. You take the hit because you caused it.
We shoulda. You shoulda. Or and maybe they'll restructure it that way.
Or they should have some kind of like forgiveness clauses like the
Mm-hmm.
PPPs.
Mm-hmm. Yeah. Wow. It's gonna get worse before it gets
It is.
better.
It
Especially
really
for
is.
the actual customer, the patient.
And the more that we talk and the more that honestly, if it was going to happen, this would be the best year for it to happen. And it would be the best time of year for it to happen. Because can I tell you, once the summer comes, which is only a couple months away, and these um um political conventions start, it's all going to be about the election. All that stuff is going to get drowned out.
Right. Change who?
Exactly.
Change what?
And they're going to be doing all kinds of stuff behind the scenes, hiding in the dark, doing all kinds of stuff.
Mm-mm-mm. And you think you don't hear, you think they dripping us with each little thing now. We gonna be thirsty as hell. Looking for something. Wow.
And then,
Interesting.
then out of the blue is going to be some other company going to be like, Harpo, who this woman?
To your point, we need to. Can we get? Where's the list? Where are the other people?
I'm telling you,
And
like,
what vulnerabilities are there? There needs to be a whole risk assessment on these whoever the other entity or entities that are involved in the additional 50% that's involved.
because there's a whole lot. Even though a lot is coming out, there's so much more that they're not saying.
Hey, I owe you a call. I got you. I got you. Hey, hey, hey. Yeah. Wow. Wow. This is crazy. Crazy. Well, y'all buckle up, buttercups. There's more to the story. There's more to the story. And you
Look,
heard it here first.
and also to everybody in HIM, you have these people here, these folks giving out our information, making it easy to get picked off, and people worried about AI taking over their jobs. No, at least not in HIM. No.
Ooh, wow. See, other things that you don't necessarily think about considering when you walking in and clocking in every day. Don't think about those things.
Nope.
But it's
We have.
out here. It's
Yep.
out here. And again, part of the revenue cycle. This is all revenue cycle.
All. And what can go wrong with the revenue cycle?
Yeah. And what could go wrong when you don't pay attention and listen to heed the advice that you were given? They gave it to you. Do this. Nah, we don't want to do that. We're gonna do this.
Because what? Because what I think I had heard something. And I really think that they should, because since they're the largest, they really should be forced out of business because they should be charged for each HIPAA violation for
Mm,
all of their clients, each one.
mm-hmm.
And they're not going to, because if they did that, they would be bankrupt. But they're not going to do it. But they should, because it was that they neglected basic and basic facts intentionally. When somebody tells you to do something and you don't do it, when you see what's going around and you don't do it, and you the biggest player in the game, you playing.
So why won't they go after them for the HIPAA violation? You think?
Oh, politics. And it's one of those, it's just like why they don't, why they bail out banks but don't send people to jail for mismanagement.
No, that's true too.
And then they, because that their talking point is too big to fail. Well, we can't have them shut down. What will we do? Find somebody else.
Yeah,
You think somebody else don't want to step up to the plate to have their stuff together?
exactly, exactly.
I'm telling you, I'm willing to bet money they're going to change their name when this is all said
Change
and done.
healthcare. It's a change is coming.
Because that's what Philip Morris did after they had to pay out all that money for tobacco. They
Tobacco.
still in business. They just changed their name.
Mm-hmm.
Arthur Anderson changed their name.
They make it so easy.
Well, for them,
Well, true. Oh Lord.
and we know who they are.
mm, mm. Wow. Interesting. Don't we give y'all food for thought every week? We don't
Definitely.
give you nothing else. Just agree, but they're a large entity and they're lobbied in. Yep. Absolutely. You're right about that. Wait a minute. Change the name and merge with another company. That part. That too. Now that you have to get your, is that supposed to be EIN online? We are
Probably EOB.
sitting on, or EOB. Okay. Online. We are sitting on checks. We have, oh, no EOB for posting. Mm-hmm.
Hot fiery mess.
It's going to be, before it even gets, Change Healthcare just recently became part of UHG, wondering if they were a Trojan horse. I don't know. Just thinking through this whole, I like to think of the end game. What you said was real interesting as it relates to these private, them getting this information and knowing who's vulnerable. That's trade secret. That's information that folks can use to then. That's huge. That is huge. And not to say that they were part of it again, but what if they were? Because then where's Change Healthcare getting all this damn money from? Let's talk about that. Let's follow that money. Because now you got all this money to pay all these, provide these quote unquote loans or what have you. Where's that money coming from?
Mhm.
Okay, y'all comments coming quick and fast. Yes, Optum, UHG, UHC, and Change Healthcare all one. They asked him about that at the House Senate. All right. We keep sipping. Thank you for coming, Maya. And like I said, I owe you a call, so I definitely I'll reach out to you this week. 22 billion in profit. Wow.
And they'll probably have this CEO when it's all said and done step down, and they'll probably give him 75 to $100 million to go walk off into the sunset.
Where is the key tam person now? Ooh, child. But it might be too late. They already, unless there's a smoking gun somewhere. Unless there's an additional smoking gun that don't nobody know about.
Well, there's a whole lot of information we don't know. They know a
Exactly.
whole lot more because I listen. I'm not. I don't. God knows I'm not the smartest person. Because if I was, we would all be in Hawaii somewhere relaxing. But
Relax.
some stuff is just common sense, and I'm telling you, I still smell a rat, because I'm telling you, I knew from the beginning. I knew,
You
I
called
knew
it.
it.
You said it.
And I know it's some other stuff that's just not right. I feel it. And it's just
Hmm. I mean,
this is
like I said, you providing this additional piece today is giving me like, whoa, like, whoa, this is
mm,
this is even bigger than what we think.
yep. Because some practices are going to go out of business.
Oh, absolutely. If not already hanging up. Like,
Exactly.
because, well, again, this is months later. They may not even have been able to sustain to wait these months later to even get the offer of the loan.
Exactly. Because from a provider standpoint, all they have to do is dissolve their practice and then go get a job. They can work at a hospital
They
for
can work where
somebody else and start all over if they choose, if
and then
they
that's
so
another
choose.
thing too. They want to hire these physicians depending on that specialty. So two for one. Pick off this pick off this competition and hire the provider.
Or
Wow.
or they could be smaller, but there could be a bigger practice that they're affiliated with in the same area. Well, let us buy, or you come and join us.
Mm-hmm.
It's way, way, way more insidious than what we think.
Mm-hmm. I feel you. Tanya wants to know where can we see the hearing, our uh on the
Well,
street
our on the street
correspondence.
course, she emailed us the link, so I don't know if it's still I'm sure it is available for a replay, because it was really worth a. I mean, because when I got into it late, but what I heard was juicy, so I could imagine. I mean, because I'm telling you that chairman played no games, and
None.
it's an old looking, but I'm telling you, he came with it.
None. Mm-mm. And we got our Patreon. Y'all know y'all privy to all of the things. Mm-mm-mm.
Oh, Crafty Coda says she posted the link.
Mm-hmm. All right, y'all. We are at the top of the hour. At the top of the hour, and I'll quickly do a little segue into our the tea sippers. So the tea sippers, the PRN's Patreon, where we provide additional conversation, insider tips, expert Q&A sessions. There's a resource library with exclusive content and networking opportunities. And baby, when I tell you we got a lot to talk about today, we got a lot to talk about today. So consider being part of the PRN's Patreon or the Tea Sippers, where you too can be part of that community. Receiving all, it is pouring down raining. I don't even know if y'all just heard that
Oh,
thunder. That
I
just
heard
came
that
back.
thunder. Yeah.
It is pitch black outside. um,
Wow.
but you too can be part of our community, and we welcome you. Come on in, check it out, see what's there, what you may need. And soon we will be offering the ability to reach out for coding specific questions. Oh my God. Coding specific. I feel like the grandmother. Turn everything off and go sit down in the corner. So again, check out our Patreon. Um,
Oh,
yeah, yeah,
but,
yeah.
Crafty Coder said that she tried to put the link in the chat, but you can. All you have to do is go on YouTube and Google, put in the search "House Hearing Change Healthcare," and
Yeah.
it comes up, and it says United Health CEO testifies about cyber attack, CBS News, and it's 2 hours, 15 minutes, and 33 seconds.
Worth every second.
Mhm.
Every second. All right, y'all. So again, this has been a great session. Thank you all for joining the Saturday morning tea, or if you're checking out the replay, thank you for watching. Was the tea spilled today? If it was, throw up your teacup. Put your teacups in the comments. Put your teacups up. Put your teacups up. Oh, oh, oh. If this information was valuable for you, help us share this message with others by sharing the video and subscribing to the channel. Be sure to follow us for more information on all things health information, compliance, revenue cycle, and of course, medical coding. And as you leave, don't forget, we need engagement. So don't forget to hit the thumbs up or like button, even if you're scared to put something in the comments. Also, check out the Coding Nurse channel on YouTube. You think he dropping gems over here? Check out the gems that we dropped over there. All right. So this has been a great session today. Oh, and I want to thank all of our tea sippers. So if you take a minute before we leave, you'll see all the tea sippers. I added that to our outro, so you'll see a little smidget of all the tea sippers that are part of our Patreon. So if you want to see your name in lights, feel free to join us. That's another perk. So
All
again,
right.
this has been a great session today. Thank you for joining. And remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care. Have a great weekend. Stay dry if you in Ohio anyway. Because it is raining cats and dogs over here.